Been called a bitch 1,000 times.
A knocked up whore. Get the F out of his effing room, you effing N-word. I've been bitten,
Choked.
Punched in the mouth.
I had a guy try to kick me in my stomach while I was pregnant.
That poor nurse at your bedside has probably been through hell.
The individuals you just heard from are America's frontline nurses, individuals who, of course, over the last 2 years, thanks to the coronavirus pandemic, have dealt with an extreme level of abuse by unruly patients, by individuals who feel entitled to anything and everything. But something that seems to be misconstrued in the media is this notion that everything has always been hunky-dory for America's nurses up until COVID. But the reality is, our for-profit hospital model has essentially been a huge problem for our frontline nurses for decades, and the coronavirus pandemic has only compounded the problem. The New York Times put together, in my opinion, an incredible video that speaks to the actual nurses to really get to the heart of this for-profit model and why it has continued to be such a big problem, especially during a pandemic. But again, let me just repeat, pandemic or no pandemic, hospitals were already incredibly understaffed when it came to nurses, and that meant that each nurse had just too many patients in order to provide adequate care. So with that said, with that context, why don't we go to the first video where I think the statements from these nurses really do matter to kind of cut through the nonsense we keep hearing about the media, especially when it comes to how COVID is really the problem here.
The biggest force that's driving nurses away? Greedy hospitals.
I could no longer work in critical care under the conditions I was being forced to work under with poor staffing, and that's when I left.
To maximize profits, American hospitals have been intentionally understaffing nurses for decades, long before the pandemic. What the hospital industry doesn't want you to know is that there's never been more licensed nurses in America. Hospitals just aren't hiring them.
There's not a shortage of nurses, there's just a shortage of nurses willing to work under those conditions.
If you don't have enough nurses, patients will die. They will become sicker and they will die.
If you're in the hospital, your chances of dying go up by 7% for every additional patient your nurse has to care for.
Now, we've been hearing about this nursing shortage. We've been hearing about nurses resigning from the work that they've dedicated their lives to. In fact, a recent survey indicates that about 40% of the nurses who are currently employed are thinking about leaving their profession altogether. And again, it isn't so much about COVID, it's more about the fact that they are given this insane workload with so many patients that they are just simply unable to take care of simultaneously. And there's a very clear reason why hospitals are doing it. Hospitals that run under a for-profit model want to ensure that they maximize what? Maximize profits. So there's no reason to believe that a for-profit hospital would be managed or run any differently than any other corporation, any other for-profit company, where you want to minimize your costs and you want to maximize your profits. And the individuals who usually bear the brunt of that system, the individuals who usually deal with the abuse associated with that system are the workers. And in this case, we're talking about the nurses. And so this problem was already there, and it was later compounded by COVID. Let's watch.
The system was already broken. COVID has just made it way worse.
In one 12-hour shift, we had 6 patients die under the age of 50. And as quickly as they got those beds cleaned, there was more patients there.
A patient grabbed my hand and he begged me to not let him die. I'm sorry. And I told him that we would do everything we could within our power. And I felt like I was ready to fall apart, but I couldn't because the patient in the next room needed me.
To understand how the situation became so desperate, you have to remember that hospitals are just like any other business. Staffing takes up about half the budget, so a smaller workforce means bigger profits.
Hospitals use this type of what they call flex staffing. So they flex for just the bare minimum at that hour of the day. And then 3 hours goes by, there's many more patients, and then it's, well, you have this many nurses, you'll have to just make do.
The most annoying thing that was ever said to me in my career by an administrator was, "We know you guys need nurses, but it's not in the budget."
So I think this is an easy story to understand, especially when we see how businesses are run and how that usually ends up hurting labor, which is of course the biggest cost associated with any for-profit business. Now, the New York Times does provide some possible solutions. And while I agree that the solutions that they're bringing up could work, I would argue that progressives, leftists tend to have a far better solution. So first, let me tell you what the New York Times is suggesting here. And to be clear, this is an opinion piece written in the New York Times. They specifically give examples of legislation that has passed in states like California that essentially regulates the patients to nurse ratio, or the nurse to patients ratio, to ensure that nurses aren't given so many patients to the point where they're unable to provide adequate care to each patient that they're responsible for. So California luckily succeeded in passing legislation like that. However, this is not something that's being done on a national level. There are other states, including Pennsylvania and Illinois, that currently have pending legislation, and hopefully that legislation passes. I think it's a good short-term solution, and I'll explain why it's a short-term solution in just a moment. There are examples, though, of other states who have attempted to pass similar legislation, similar regulations to make sure that nurses aren't given too many patients. But it turns out that, like with any other for-profit business model, any other industry or private sector where profits are always considered more important than people, you get the corporate interests at play, they get involved, they spend a lot of money, and what do? They defeat those efforts. So here is some more information on that.
But a similar law in Massachusetts failed to pass in 2018, thanks in part to a $25 million campaign by the hospital lobby.
It puts government in charge of deciding how nurses care for patients, with the same rigid staffing ratios at every hospital in our state. A one-size-fits-all attempt to override the professional judgment of nurses.
The problem with these ads? They're misleading. Just look at California, where a bill like this did pass. The result? More nurses hired, more nurses staying in their jobs, and better patient outcomes.
So yes, there could be attempts to pass legislation either on a federal level or on a state-by-state basis to ensure that there's a way to mitigate the very clear profit motives that are motivating these for-profit hospitals to be incredibly understaffed. Like, people die as a result of that. So in the very least, state legislatures, the federal government, there should be an effort by the very individuals who were elected to represent our best interests to do something about this, to not only protect us as human beings who deserve adequate care, but also to protect our nurses. I mean, there was a lot of talk, especially at the beginning of the pandemic, about how, oh my God, these frontline workers, these nurses, they're heroes. Why don't we all clap for them as they're walking to work, but then pretend as if everything else is all hunky-dory? No, we need to make sure that these healthcare workers, the individuals who are in fact dealing with the brunt of the pandemic, are treated fairly, that they're in better working conditions, and that they're compensated adequately. And yes, you can do that through legislation. You could do it through regulations. But what tends to happen with regulations, especially in the United States, you have private interests that do the lobbying, that engage in the legalized bribes. And little by little, even after all the hard work is done, even after all that policy is debated and we finally get legislation passed, they'll chip away at it little by little by little with their lobbying, with their legalized bribes. So I would argue that we should just cut to the root of the problem here, which is a privatized healthcare model that does not serve the American people well. It doesn't serve our healthcare professionals well. It doesn't serve us well. And if we continue moving forward with a for-profit model, I have no doubt in my mind that those with a vested interest to profit off of our healthcare system will claw their way back to square one, where nurses are dealing with an insane number of patients, which of course they can't provide adequate care to. That's really the heart of the issue here. Again, COVID certainly compounded it. COVID, for all of the pain and suffering that it's brought forth, has, in my opinion, been an eye-opener for many Americans. I think many people are clear, it's abundantly clear that we have a broken system, especially when it comes to healthcare. We were not prepared for a pandemic, even though we had unlimited resources and could have absolutely been prepared. Having a for-profit, privatized healthcare model put us in a terrible position to respond adequately to the coronavirus pandemic. And yes, if you go to other countries that let's say have a single payer healthcare system, they ran into issues as well, especially when you would see COVID surges due to new variants. But they're not having problems when it comes to ensuring that people are tested. They're not having the problems that we've experienced from day one with this pandemic. We see that the system is broken. We see that it doesn't work, and it's time to actually do something about it. Making changes here and there with regulation is not good enough. It might be a good short-term solution, but like I said, regulations can easily be reversed with adequate lobbying by corporate interests. And I have no doubt that that's what would happen here if we do succeed in passing legislation. So I wanted to make sure to give the nurses a voice here because everyone loves to speak for them. And I was really happy to see that the New York Times sat down and put that video together and heard their side of the story. So the next time you hear some right-wingers say that nurses are quitting because of vaccine mandates or some other nonsense talking point to fit whatever narrative they have, don't listen to them. Don't listen to anyone. Just listen to the nurses. Listen to what they're telling you because they're just asking for help. And they absolutely deserve it considering the fact that they've dedicated their entire lives and careers to helping us.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.